Well, it's been nearly 3 weeks since Oklahoma City leaders passed a mask ordinance requiring masks to be worn in indoor public cases. And right now, the city and the state seeing a rise in coronavirus cases. Joining us now live to talk about the city's response is Oklahoma City Mayor David Holt. Mayor, good morning. It's been a while since we've had you on. So how are you doing?
I'm doing great. Good morning. Thank you.
Great. I'm glad to hear you're doing well. So let's talk about this. The mask ordinance been in effect now for about 3 weeks, and we still have about another month for it to be in effect. Based on the current infection numbers, are you already looking into possibly extending it?
So, well, first of all, it's been 2 weeks and 3 days, but who's counting? And I am counting, of course, because it takes about 3 weeks to really see the impact of any restrictions that you put in place. I mean, if you think about the fact that, once you've started something, like in this case, a mask ordinance, it may take 10, 14 days for people to show signs of having contracted the virus. And then it may take them a little longer to get tested. It may take a little longer than that, sometimes an unfortunate amount of time for us to get those test results. And so all of that doesn't really show in the data that we receive for 3 to 4 weeks. So it'll be 3 weeks this coming Friday when we passed the mask ordinance. And so we haven't necessarily seen, the benefits of that yet in the data, but we know it's coming. And we're anxious to see it because we've been at an elevated level now really for about 2 months. We first started talking about that in mid-June when we saw the ramp up in cases. And our hospitalizations have followed suit. When you look at our hospitalizations, we've been at about 200 people in the Oklahoma City Metro hospitalized every day for COVID-19 now, and that's been very consistent. A number between 190 and 220 has been our hospitalizations for COVID-19 now for about a month, and that's what we really want to see come down, as well as cases. So we're anxious to see those results. Now, you asked about extending it. That's certainly a conversation that the council will have, I'm sure, at some point. It goes through Labor Day. And so, we'll just have to see. But that's probably, that conversation sounds like it's probably a few weeks away. We want to make sure that that we have the votes, quite frankly, and that the supporters of the mask ordinance do see the merit in continuing it.
Now, you mentioned hospitals and the amount of time that it takes to get COVID-19 test results right now. Are you concerned about our hospital capacity?
Well, yes and no. I mean, I am concerned about the trajectory we were on. When I listened to hospital officials, they were very concerned. That's what matters. And they've been very concerned for about 2 months now, ever since we went through a period where we doubled in hospitalizations and then we doubled again and got us to that point where we're at about 200 people in the hospital every single day. And it's been, if you look at the chart, it's just a remarkably flat line. That's about where we've been. And why that's remarkable is it's a different 200 people every day. It's not the same 200 people, but we've been very consistent in how many people are in the hospital for COVID-19. 200, if you listen to our hospital officials locally, is okay. It's manageable. I think what's always put us in a place of concern and why we wanted to move forward on the mask ordinance was that anything more than that, and we really do start to stress the system. And for example, if we doubled again and we went to 400, then we're really in a bit of a spot. And that's because of staffing as much as anything. We can always put more hospital beds out. I mean, there was a time period very early in this pandemic when state officials were touring the Cox Convention Center as a place to put patients. We can always find more room for patients, but we have a real struggle finding the people to take care of them. We can't simply deputize people and make them nurses and doctors, and we certainly can't draw from other cities because they're having, Tulsa and Dallas are having just as many challenges as we are. So we really have to keep these numbers where they are and hopefully get them down. And I hope that that's what we'll do through the effects of universal masking, which has been proven to reduce the transmission around the world.
And Mayor, right now there's a conversation across the country for more states to enact stricter restrictions as those states that are seeing a higher number of cases, for example, Texas, California, Florida. Governor Kevin Stitt was actually accused of ignoring some recommendations from the White House Coronavirus Task Force, which included the closing of bars, the limiting of gyms. Now, cases, here in Oklahoma do continue to increase. Do you see a potential need to reenact stronger restrictions in Oklahoma City?
Yes, I think we should always be having that conversation, and every tactic should be on the table. we are challenged, and I said this way back on May 1st when the governor lifted restrictions. Certain things you can do have no public health benefit if it's not being done across your whole metropolitan area. For example, closing bars. There's no question that would reduce the transmission of COVID-19. But if we just close the bars in Oklahoma City, then people are just going to go to bars in other cities. We have a lot of interior suburbs. We're a very interestingly created community. We've got suburbs all around us, but also inside of Oklahoma City. And so that's why it really has to come from the state level when you're talking about closures. Because if you don't close everything in your metro, you're just transferring the activity to another place. And so that's one of the struggles we have. I'm still having those conversations with council about further restrictions, and I'm certainly open-minded to it. I'm very hopeful about the masking ordinance. I mean, if you talk to anybody in public health, they'll say that's by far the most impactful thing you can do. So we have done the most impactful thing you can do. But I'm still very open-minded about talking about some of these other things. But there is a real challenge in not doing it on a regional level. And I don't have that authority, nor does the council. We really do depend on the governor to some extent to help us bring continuity to the restrictions across the metropolitan area.
Yeah, and this is something we're going to be dealing with for quite some time. So, of course, we're going to keep up with that and keep updated with you. But I do want to ask you about this, just as we're running out of time here. Representative Sean Roberts saying that maybe we need to re-examine the tax benefits given to the Thunder if they kneeled at the game. The players did kneel. What are your thoughts?
About the tax benefits? That's ultimately a state question. He's referring to an amendment that was passed when the Thunder arrived here to our state's Quality Jobs Act that gives the Thunder some financial support. I was a senator, so I can attest that, to my knowledge, Representative Roberts does not remotely have the authority to follow through on that threat, and it was more kind of a publicity stunt. So I do know that the people of Oklahoma City strongly support our Thunder. We're very grateful that they're here. And the things that were done in 2008 to get them here are certainly promises that this community and this state should keep. And as far as, the way that they're challenging us to consider continue working towards racial equality is a perspective I think we need to welcome and we need to listen to.
All right, Mayor David Holt, thank you so much for joining us this morning. Of course, we'll, looking to speak with you again soon as we catch up on everything coronavirus related. Thanks for being here with us.
Thank you. Be well.